Okay, guys, this is the last part of injuries to the tissues, looking at the skeletal system or skeletal system. Um, One of those is the English pronunciation. I can't remember which. I've been here so long that sometimes I get confused. Okay, so we'll start with function. Now, the skeletal system is made up of 206 bones. They perform five specific functions. Okay, so firstly, they provide support, right? Without your skeleton, you would just be a blob on the floor of muscle, fat, and organ. So your skeleton provides support. Okay, so our muscles and organs are kind of hung together inside of that um, support network. Next, they protect the internal organs. Best examples of that are the rib cages, or the rib cage. You only have one of them. Protecting your lungs and heart, and stomach a little bit too, and spleen. Then you have your skull protecting your brain, and then to a slightly lesser extent, you have your pelvic girdle protecting your reproductive organs. They also provide leverage for lifting and movement when the muscles contract. If the muscles weren't attached to the bone, when the muscle contract, nothing would happen. But because the bicep is attached to the skeleton over here and here, when it contracts and shortens, it causes movement around the joint. Okay, so that leverage and movement is not possible without the skeletal system, even though the muscles are the primary movers. They produce blood cells. Red and white blood cells are produced in the bone marrow, and they store the majority of your calcium supply. Okay, so we keep a supply of calcium in our bones. Interestingly enough, or at least I think it is, when a female is pregnant, the bones for the unborn child, the calcium for that, most of it comes from the bones of the mother. So it's like the unborn baby is kind of like a parasite pulling the calcium out of the mother's skeleton, which actually leads to we have a higher rate of bone fractures with pregnant women because they're often calcium depleted at that time of being pregnant. Okay, sorry, I just got a text message. Let me just check. Okay, no big deal. So, types of bones that are present, we have five categories. We have long bones. So these are kind of the classic cartoon bones, is what I call them. You have heads at the end and then a shaft connecting it in the middle. That's a long bone. Um, Short bones are similar in width and length, so you can't really tell which way they are. So obviously with a long bone, there's a clear line of which way that bone is going. Okay, so with a short bone, they are similar width and height. So examples of those would be the carpals in the wrist and the tarsals in the feet. Flat bones are parallel plates that are really close together, so they're flat. Skull is a flat bone, scapula, pelvis, those are flat bones. Irregular bones don't really kind of fall into a category. So basically, an irregular bone, the shape of the bone is very specific to the job that it does. Okay, so like your jaw, your mandible, that's irregular. There's no other bone that looks like it. It has that U shape going round, and the way that it connects in to allow it to articulate, to open the mouth. Okay, so a lot of our facial bones are irregular, and our spine is the vertebrae are also considered irregular because they stack in a very specific way. The last one is sesamoid bones. These are bones that are kind of found within tendons. There's not many of them. Best example is the patella. So the patella kind of has the muscle connecting over the top, and then in the middle of that tendon, you have the patella or the kneecap sitting there. So those are our five categories. Okay, here's a picture of a long bone. Again, remember, long bone, shaft with heads on each end, classic cartoon bone. You will be drawing this diagram later in the week, so I'm not going to go too much into discussing it here. Make sure when you do those drawing assignments that you take your time. Don't just try and get it done in 5 minutes. Take some time, be deliberate, and that's when you learn stuff. Drawing is a really good way to learn. Okay, so we're going to look at some of the structures within that. Firstly, are these two descriptions of kind of the shapeage, is that a word? The shape of the bone. We have the diaphysis and the epiphysis. The diaphysis is the shaft, and the epi is the ends. Okay, so that's a description of it. So what did my note say? Main shaft of the bone. It's hollow. It has compact bone, really really hard around it. The epiphysis, or the ends of the bone. This is where the growth plate is. So the growth comes from that area. Well, in adolescence anyway. Obviously, my skeleton is not growing anymore. Now, if you have fractures near the growth plate, as a younger person, it can be dangerous. So they look at these things called Salter fractures, which I'll show you a graphic so you can see. So that green line is the growth plate. So this is the diaphysis here, the shaft, and the epiphysis here is the end of the bone. The growth plate's in the middle. So there are some fractures you can get here in the growth plate that can be really kind of dangerous for young people and can cause kind of stunted growth. First one is if you get the fracture straight across, above, sort of coming into it and then above, into it and then through, down, lower, all the way through it, or a crushing fracture, pushing it through the growth plate. So those are known as Salter fractures. And these are particularly dangerous for adolescents because stunted growth. Okay, going back to structure. At the end of the bone, you have this articulating cartilage. Remember, articulation is another word for joint or movement. So you have cartilage that allows or accommodates articulation, articulating cartilage. So this is the end of the bone. It provides some cushioning and protection during movement. The really nice thing that it does is it's super smooth and allows the bones to slide past each other. The periosteum, this is the outer layer. Let's go back and look at the picture and show you where it is. There we go, periosteum. So this is the outer layer of the bone. Okay, so you can see it right there. It's really dense and compacted. This is really important because it has these specialized cells that help promote bone growth and repair of the bones. Okay, your bones are able to repair themselves and kind of re-knit if they do get breaks or fractures. Okay, so the medullary canal, this runs right through the shaft. And this is where the yellow marrow sits, which is fat cells. So this is right in the middle. And this canal is lined with the endosteum, and it basically holds it intact because that yellow bone marrow is not solid. So it needs to have this thing surrounding it to hold it in place. Then we also have a different kind of bone marrow called red bone marrow that's present in only some bones, not all of them. So present in the ribs, sternum, scapula, femur, actually at the proximal ends, the top of the femur, and in the humerus. This is bone marrow that's responsible for making both red and white. So the erythrocyte, that's the red blood cell, and the leukocytes, those are white blood cells. So that occurs in the red marrow. Okay, so the primary injury that we can have to the skeleton is fracture, right? So these are the signs and symptoms of bone fracture. Now, one of them by itself doesn't necessarily mean that you have, a broken bone. So if there's pain at the site, that could be all kinds of things. Okay, so tendonitis is pain at a site. All the other things, strains and sprains that we've looked at over the past couple of weeks usually have pain. So by itself, that's not really a good symptom to diagnose, a diagnostic symptom. So you look at a variety of things. Deformity. So we might see a unusual line in the arm because the bone has become broken. You can see bone coming through. Sometimes it won't come all the way through the skin, but will press up against the skin, showing like a lump. So that would be deformity. Edema or swelling at the injury site. Now, with broken bones, edema and swelling usually is really, really rapid, more rapid than a sprain, which sometimes can take a little while to develop. With a broken bone, we often see really rapid edema. Ecchymosis, which is a great word, that just means bruising around the site. Again, by itself, that's not going to tell you. It's not going to tell you that you have a break. It's going to be with some of the other things. Grating or crepitus is a really good sign of a broken bone. This is where, as you can either like feel into the bone, like along the bone to kind of check for pain, and if you feel or hear a grating sound or grating sound upon movement, that's crepitus. That grating sound is not present unless there is a fracture. So crepitus actually is present in another situation. But crepitus is usually a really good sign of fracture. Immobility. So if you get a broken bone, then it's very hard to move that joint next to it, or if it's in the joint. So immobility, numbness, tingling, and sometimes we see signs of impaired circulation. So that broken bone can prevent blood circulating below the injury site. So if you see pale or cold skin below the injury site, that could be symptomatic of a break. And then obviously, if you are there when it happens, the mechanism of injury can tell you something, right? If you see somebody fall in a way that indicates a bone might have been broken, or there's impact into someone's leg from the side, and those are good clues beyond symptoms. So that's mechanism of injury might tell you, give you a good idea of what's happened. Okay, so we're going to look at a bunch of different types of fractures, and I do have an assignment later this week, which is trying to identify these fractures from X-ray pictures that I've put up. So make sure you take good notes here. The first two are contrasting, so closed versus open. Closed means a break that stays inside of the body. Okay, so the bone does not penetrate, no skin is broken. On the opposite side of that, we have an open fracture where the bone has broke and then come through the skin, also known as compound fracture. And if you had me as a freshman, you heard me tell that story about when we had an open fracture in a PE class when I was in high school. I'll probably tell that story at the end, so you can choose to listen to it or not. Next is an avulsive or an avulsion fracture. This is where part of the bone is ripped out. So basically, you have a tendon plugging into a bone, because that's how the muscle attaches. If this muscle and tendon is under great tension, sometimes it can rip away and pull a piece of the bone off. So this break will be right at the end, at the site of attachment of a muscle. So it's typically near the end of a bone. I had an avulsive fracture on my finger, and that's why it looks like that. Okay, so it got hyperextended, and then it ripped a piece of the bone of the epiphysis off of my, which would have been my proximal phalange on my little finger. Stress fractures, these are not an acute injury. So stress fractures are caused by repetition. So if you're constantly doing the same movement over and over again, then it can lead to gradual cracking. So this is a type of fracture where people can continue to play through and just think it's pain, and it can be a stress fracture. A primary place where this occurs is tibia and fibula, because those are load-bearing lower body legs, bones that aren't as solid as a femur, right? Okay, so they're thinner, they're load-bearing, they're involved in every step you take. So typically stress fractures occur in the lower body, around, usually below the knee, sometimes in the foot. I coached in college for a little while. I remember one year we had like 3 or 4 stress fractures of our incoming freshmen coming into college, because they'd basically been playing too much volleyball for the last 5 years of their lives, and they had these stress fractures. A green stick or green stem fracture. This is an incomplete fracture. I will show you some pictures in a minute. Um, Basically, this happens in young people or like kids, toddlers, when as you snap the bone, it doesn't fully break. It only breaks on one side and the other side stays whole. It has that name because if you've ever tried to break a green branch on like a new tree, when you break it, it bends and it'll only crack on one side because it's still quite flexible. Impacted, this is basically a crushing fracture where the bone is kind of pushed into each other, causing compaction at the ends. Can be in the middle of a shaft or between two bones. Basically, parts of the bone get embedded into another part. Then longitudinal or a linear fracture is the fracture going down the length of the bone. Okay, these are less common. Okay, one of the primary places these occur is under high compressive forces, usually like landing as for a jumping athlete, like a triple jumper, long jumper. Getting that pressure going through the bone as they land. That's the kind of type of athlete that we'll see a longitudinal fracture in. Okay, there's more. There's lots. Oblique is a diagonal fracture across the bone. Again, this will make more sense when I show you the picture in a minute. Spiral is a spiraling fracture that breaks and curves around the bone. This one occurs when you plant your foot and then you turn away rapidly. This can occur with football athletes who are wearing long cleats in a wet field and their foot gets planted and stuck. Sometimes by basketball players as well because they have a lot of those twisting motions. Next up, we have transverse. This is a complete break at a 90-degree angle to the shaft. Okay, so if that's the shaft, transverse would be 90 degrees going across it. Comminuted is where the bone is shattered into multiple pieces. So there usually has to be pretty tremendous force for this to occur. It's usually like a crushing or a side hitting into the shaft, causing it to fracture and splinter. Then the last one is a blowout fracture. This is where you kind of see the fracture radiating out. The best place to see this, when I say best, it's not best for anybody, is if you get like a baseball right into the eye, into the socket, you'll see the fracture going out in kind of both directions, an orbital fracture. Okay, so here are some pictures. Transverse going across, linear or longitudinal or long, oblique is on the diagonal, non-displaced and displaced where they are fully separated. See that spiral one twisting round. Green stick, it's just broken on one side and the other side stays intact. Comminuted, we can see that's not very clear, but there's lots of little pieces in there, so it's broken into 3 fragments. Avulsive, so this would be the tendons attached here, and then as the tendon's under stress, it rips a part of the bone off. An impacted compaction fracture where you have that pressure going there, and then I have another green stick or green stem fracture there. Okay. Now, when we treat a fracture, this isn't something we're going to fix, right? So this is EMS, often surgically repaired. So it's just about making them comfortable and keeping them safe. We have kind of 2 situations here. One is if it's an open compound fracture where they are bleeding, we want to try and stem that bleeding. Now, unlike a normal situation, if somebody has that compound fracture, the bone sticking through, normally we would apply pressure to the wound. If you apply pressure to a compound fracture, that person is going to scream. So you want to put a dressing over it that can help with the clotting and absorption of some of the blood. But you want to try and slow flow into that area by using pressure points. So if that open fracture is in my forearm, we want to use a brachial pressure point to try and decrease the amount of blood flow here to give it a chance to clot by itself, putting a sterile bandage over the top of it. If it's a closed fracture and we don't need to worry about bleeding, then the most important thing is making this person comfortable. Okay, so don't move that broken appendage, arm, leg, unless you have to. Um, whether that's sitting them down, lying them down, having them hold and support. Um, but we want to make them comfortable while we wait for an ambulance. We can splint, and we went through a bunch of splints around Christmas time to restrict movement. But it's really, really important that you are really careful placing those splints on. Um, because we don't want to cause any extra movement. Elevate if possible. So if we have a broken wrist, that one is easy to elevate. If you've got a broken femur, much harder to elevate. Apply ice carefully and then monitor vital signs. Remember, if you are choosing to splint, you want to do CMS before and afterwards, right? To check that you're not compromising, or to check and see if they don't have compromised circulation. Okay, that is it. So I will briefly tell you the story of the open fracture that happened in my PE class. We were, and remember, PE in England's a little different. Like, they let us do some more risky things that would not happen in California. So like, we used to do javelin in PE. We also did like full-on Olympic trampolining with like the giant trampolines, where you can get like 10 feet plus off the trampoline. But my PE teacher, for some reason, allowed us to have two people on the trampoline at one time, which is not a smart idea. And I'm sure that got changed afterwards. So basically, we had these two girls on the trampoline going up and down. One of them, her name was Helen, slipped and fell. And then the other girl came and landed right onto her leg and snapped her tibia and fibula. And the snap went down, so the bone went down into the trampoline, and the bone came through the skin and then through the trampoline. And then all of us had just stood there, just like wide-eyed and completely shocked. And it was, we quickly got hurried out by the teacher, the ambulance, paramedics came, and they had to cut her out of the trampoline. And if you've ever sat on a trampoline while somebody else climbs onto it, it bounces up and down. So we could hear the screams from the changing room. It was quite unpleasant. Poor Helen had to walk around with this massive, like, steel plates and pins on the outside of her leg for like 6 months afterwards. And then I had a friend who was kind of a jerk who would walk around her going boing, 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 crack, which isn't the nicest thing. But that's my story of a compound fracture. Okay, hope you guys are well. It's actually Thursday of the week before you get this. I'm recording this, so I'm going to see you guys tomorrow, hopefully, to pick up tape. I will see you then. Bye for now.